And I know this is a very contentious topic, but it is the battle. It's, because you see people who obviously their quality of life has gone in just immensely better. No more ulcerative colitis, no more depression, no more Crohn's disease, no more rheumatoid arthritis, no more constant debilitating pain. And the trade-off is their cholesterol goes up. And so somebody said, well, theoretically, they're at higher risk for heart disease, which may or may not be true. And I think it's a battle that, I think it's something. And I agree that, I have gotten over the years, I've been called every name in the book, from Hitler incarnate to, something like that, just because I'm saying let's promote a diet that seems to be helping people in a number of ways. So thanks. And I'm glad to see other people are taking up that fight, because I think it's a fight worth having. And let me ask you you said 5 years ago, and I'm the same way. 10 years ago, you'd asked me, I thought, yeah, Carnivore Diet, that sounds crazy. I'd never heard of it 10 years ago, but I would have thought that for sure. What was the switch that made you go from, I'm pushing the eat a lot of vegetables and whatever to carnivore a couple of years ago?
Well, I have to say, people who knew me before, honestly, I'm a healthy guy. I was maybe overweight during the years of working crazy hours at the hospital and in the office, etc. I could say that I used to sit down and eat an average salad of Romanian lettuce, cauliflower, broccoli, olives, mushrooms, tomatoes, cucumbers, balsamic, and olive oil every day. And to be honest, I would be bloated like I was 9 months pregnant, and I was musical, and for keeping it cute. And I never appreciated that I was getting my body's telling me that something's wrong, that isn't a good sign. And I have to give it to COVID-19, where because of the situation, and I ended up not being in the hospital and not being at the office and just at home, I had so much more time to study and get into it. And again, these are taboo conversations on a certain level, but without going into it, I started treating people for COVID back about June 2020. And I was looking out to some of the people out there looking to see what China was doing and everything like that. And so I started, I have to go back to Dr. Bartlett out of Texas, who came up with a certain protocol. And I have to say it worked phenomenal. And so I went that route. And since I saw that things were working differently, I also wanted to see what else is. And as I began looking at nutrition, I have to give it to, it's Nina Teicholz, if I'm pronouncing her name correctly, looking at the American diet rules and seeing that there's no science there. And then I stumbled on the carnivore. I saw one of your videos. I saw one of, I saw it and I said, you know what? I want to know more. And I read Paul Saladino's book. And I've always been a glutton for liking mechanisms or liking research. If you give me a science paper, I'm going to go look up the paper itself and read it myself. And so that's where I got into carnivore. It just made sense to me.
I do think the nice thing about this last couple of years with this COVID pandemic, it has caused a lot of people to reevaluate who they trust, what their sources are, and when you look at that and you realize that maybe the CDC, maybe the FDA are not necessarily infallible, and maybe there is some reason to cause concern there that you can you question a lot of things.
Yeah, I don't know. The way I see it, I was told I couldn't see my patients anymore because of COVID. And it just made no sense to me. I said, what do you mean? Listen, I've seen infectious disease my entire life. I worked in the hospital. I went in for tuberculosis, which is infinitely more infectious. And so why are we suddenly getting crazed about something that, 99% get better without seeing a doctor? So it was hard, but overnight, the American medical establishment basically abandoned their patients and said, if you're really sick, go get tested and go to the hospital. And and the fear of going to the hospital. So it was a real problem. And so that really sent me down the education line. And so I think if one has an autoimmune disorder, one has hypertension, one has all these different issues, I'm not going to say that you do carnivore and they're going to disappear in a week, 2 weeks, a month. You didn't get to where you're at in 3 days. You didn't get there in 3 months. You spend 10, 20 years of eating bad food. So it's going to take time to reverse it. But the more you learn, the more you realize that so much what doctors have been pushing is incorrect. You got to remember, as physicians, we've been pushing cholesterol medicine for 30 years. Nobody's reversed heart disease.
Yeah, and it's interesting, and for maybe you guys that don't know that, maybe you're aware of this. They're actually working on a vaccine to address cholesterol, and so they can do a vaccine against the cholesterol synthesis or cholesterol the PCSK9 gene, I believe, is being targeted as a vaccine, which I am very concerned. You can imagine if they put that on the childhood vaccine schedule where every kid gets an anti-cholesterol. I mean, I'm not saying that's happened, but it's within the realm of possibilities, which is quite concerning.
For me, it's scary. It's frightening. It's frightening. If like yourself, there's a wonderful doctor online a cardiologist by the name of Nadir Ali.
Mm-hmm. Yeah, I know Nadir. Yeah,
and he really spells it out beautifully. And I've stolen his famous statement of, is cholesterol really the arson burning down your house, or is he the fireman trying to save you from yourself? And if you step back from a moment from the mantra and you look, what does cholesterol do for us? Without it's essential. You need it. And so to do a vaccine that's going to block this is just going to take people's health away. It's wrong. We're again, I'm just positive from all the research that's coming out that the doing away with cutting back significantly on any type of sugar is the answer.